cultural diversity has to do about learning the culture of your patient if you're not of the same culture, okay? And secondly, the language you're using. So for example, with my Greek American patients that I'm doing parent coaching online, I do use a mixture of English and Greek. And this doesn't depend only on the terminology. It depends also on how they feel each time we're having the session. For example, some more sentimental things are said easier in your native language. In your native language might be the Greek, for example, or Italian, might not be English. English is your host language, although you might speak it perfectly. So if you're not a native speaker of the language, if you're a therapist that is dealing with foreigners or immigrants or Americans that have a strong ethnic background, okay, some of the things you might need to know in advance. Okay, especially methods like ABA, which we use a lot of verbal commands, and in general, it is important to know the language structure. Okay, the mother language structure. So usually the therapy might be done, for example, in English. We do not use monolingualism in cultural diverse therapy. We use the mother language usually, but the therapy itself can be done, for example, in English, but the therapy should be applied usually in the language that is dominant in the house, which should be the mother language. Why? Because there are studies that say that if you follow the mother language, then the child can understand better, okay, and interpret better its world, okay, in all aspects, let's say cognitively, sentimentally, and everything. So the problem is that English usually that we are using as a lingua franca and lingua de jure in most cases is a very straightforward language. Whereas, for example, Turkish is an agglutinative language, which means that we add things, right? Or for example, if you take Russian, you don't have verbs like I am. So some of the things, some of the methods we might be using may not be apt for teaching our children. So you have to be aware, because in some cultures, people might be so nice, so polite with you that they will not inform you that this does not exist because they do not want to insult you, especially when you go into Middle Eastern or Oriental cultures. Okay. So other languages may not have plural or may have inclinations, which English, for example, does not have. And in other languages, like, for example, in dialects, we have Cypriot dialect, which is totally different than Greek. Okay, the written forms, or like in Arabic, may differ significantly than their spoken ones. So when the transition period comes for a child to go to school, some of the things he might have been taught to, let's say, cognitively, like commands or fairy tales, might not be exactly accurate as the ones he will be reading or writing. So knowledge of these languages is necessary at least to basic intermediate level. Let's say if you're talking about languages, you need to know the language up to level B1, B2, if you're familiar with the terms, or have an interpreter. And the interpreter can be a sibling. In many cases, especially from my experience with Chinese families, the interpreter was usually a sibling, right? So, cultural intervention challenges. There was in many cases a disconnection between the medical aspect and the intervention goals. Why? Because in some societies, doctors, like in Greece, for example, just may diagnose, but don't set goals that are specific. They will just tell you do speech therapy, do OT, and they will not set specific goals. Whereas in the States, different, in the countries, different. Some medical disciplines may not be recognized or may not exist. For example, developmental pediatrics in many countries around the world does not exist. Exists child psychiatry, exists child neurology, but developmental pediatrics does not always exist, and I'm a developmental pediatrician. Okay, expertise by US standards could be limited. And the age of diagnosis also significantly impacts the results of the intervention. And why is this a culture thing? Because usually people, according to the cultures, may be delayed in getting a proper diagnosis. For example, also in Greece, people found it hard to believe that their child had a problem. And they would only, let's say, admit to themselves that they had a problem when they came face to face with the educational system around the age of 4 or until 5. And then common beliefs like boys, unfortunately, they said, delay in talking. This is an urban myth. This is not like this. This is not the case.
To kind of summarize Dr. Demetrius's key points, I think it's so true that, language is always a big barrier in trying to understand the that specific cultures like language and just like the little nuances. I think that makes a huge difference in being able to establish rapport with families. Additionally, I think understanding just the cultural beliefs and values, it's huge. Like just knowing like what's appropriate in that culture and what's inappropriate. Knowing certain dress codes, like learning just like basic etiquettes. I remember we had a student and she was providing ABA therapy in Senegal, Dakar, out in Africa. And she told me, because I was teaching an ethics course, and I said, oh yeah, according to our board, it's very unethical to decline food. We shouldn't, be eating food with families that we're providing therapy to. It's unethical. And she reached out to me and she said, that's very concerning, because if I were to do that in this culture, like that is a huge disgrace. Like that would be like slapping this family in the face. So, I think it's very important to understand the different cultural beliefs and values. And if it kind of, I'm not saying be unethical, but at the same time, if it conflicts with the ethical guidelines of our governing board, I do think it's important that we place value over that family's cultural beliefs and values, because then we're putting the value and importance in that particular family. And we're valuing them as an individual, as well as respecting their culture.
Exactly.
I think it's also really, some of the points that Dr. Demetrius talked about in terms of, helping families change their perspective of ABA therapy, and it's not a bad thing. I think that's really important. It's great that Dr. Demetrius is in Greece and that he's changed the perspective of a lot of Greek families, that 2 hours of therapy is not enough, because research has shown that, for really little kids, early intensive intervention is what's really going to lead to the best prognosis. You also talked about gender, like understanding like gender roles in different different cultures. And that's also really, really important. And it's a very sensitive topic, but it's also something that we can't just disregard. And I think just at the end of the day, the takeaway is the field of applied behavior analysis, if we understand the principles of it, it's really rooted in the American ideology and American values. But the science behind it works. And I don't think the science behind ABA discriminates against one culture or another culture. I think as practitioners and as future behavior analysts, it's our job to say, how can we disseminate this science so that it's applicable in many different countries, across different cultures, and so on.